turn now?
Jody Moore has known since she was 12 years old that she has asthma, but it wasn't until she was pregnant with her first child that it really began to take a serious toll on her health.
The asthma just went crazy, and I had to call my doctor in the middle of the night.
The asthma attacks lasted for weeks. It got so bad at times that Jody considered going to an emergency room for treatment, but a new study shows that may not always have helped.
We found that in general, when pregnant women presented for treatment of their asthma attacks, at least with mild or moderate attacks, that they were treated differently than non-pregnant women.
Dr. Jennifer McAllister is an expert in asthma at Ohio State University Medical Center. In a small but revealing study, she found that 2 out of 3 pregnant women who came to the emergency department for asthma flare-ups did not get the same treatment as non-pregnant women. Usually, doctors will give patients steroids to control their asthma, but in most pregnant women, that wasn't the case, and it led to even more problems.
We actually found that in those women that were not treated as often with steroids, that they tended to come back to the emergency department more often.
Even though they're only initial findings, McAllister believes this may be an issue in hospitals everywhere and wants to do larger studies to find out. In the meantime, Jody wants to make sure all women with asthma know the risks.
I think for people who have asthma that say, oh, it's well controlled, I just pull out my inhaler every once in a while, you know, if you're going to get pregnant, think about it and maybe make sure your doctor is aware of the risks too, because it came on pretty suddenly for me.
At Ohio State University Medical Center, this is Clark Powell reporting.